Okay, now the last thing you want this weekend is for a medical problem to get in the way of the fun. So here on the Morning Blend, we find it important to highlight advances in healthcare.
Alex had a chance to chat with a doctor about keeping your heart in check.
Heart failure occurs when the heart muscle is unable to pump enough blood to meet the body's demands, and it affects millions of Americans. Here to tell us why we should take this to heart is Dr. Jeffrey Borer. Good morning, doctor.
Good morning, Alex.
So tell us just exactly how many people actually have heart failure in the U.S.?
In the United States today, about 5.75 million people have heart failure. And one of their greatest problems, in addition to the symptoms of the disease itself, is that so many of them are going to be going to the hospital this year. A large portion of that group will be hospitalized every year. That's a problem because nobody wants to go to the hospital and because it costs a lot of money. 3/4 of the cost of managing people with heart failure in the United States is the cost of hospitalization. So anything we can do to reduce that burden is a good thing.
Right, and I think part of that process is educating people. So what exactly is chronic heart failure?
Chronic heart failure is a condition in which, as you said, the heart is unable to pump sufficient blood to meet the needs of the body. That results in symptoms like fatigue, getting tired, doing things that you used to be able to do easily, shortness of breath. That's breathlessness with activities that used to be relatively simple. Swelling of the legs or feet. These are the most common symptoms of heart failure. There are many others, of course. But a big problem, again, is the problem of hospitalization. And that's what Corlanor has been developed to try to minimize. The studies with the drug suggest, and the basis for the approval of the drug by the FDA indicate that using this drug on top of all the other drugs that we use for heart failure reduces the likelihood of hospitalization by 26%.
And so why is it that people who have already been diagnosed, already on medication, why is it that they're going back to the hospital?
Yeah, it's a very good question. There are many reasons why heart failure worsens in people with chronic heart failure. The progression of the disease itself is one of them. Drugs can make things better, but it doesn't stop the progression of disease. Other things can be involved. For example, if somebody goes to a baseball game and eats a hot dog, that's a big salt load that can bring fluid into the bloodstream, which increases the load on the heart and causes an acute decompensation of the already existing heart failure. A heart attack can make heart failure immediately worse. So there are a lot of reasons why people can have an exacerbation of their heart failure and need to go to the hospital again.
Yes, and just how profound is this new treatment option for people with this condition?
The benefit of Corlanor is that it reduces the likelihood of hospitalization. In fact, on top of all the other treatments for heart failure, in patients who are appropriate candidates for the drug, which means their heart is not pumping strongly enough and their heart rate is greater than 70 beats per minute in a normal rhythm, if they are given Corlanor, the likelihood of going to the hospital is reduced by 26%. That's the main benefit. Now, of course, this drug isn't for everyone. No drug is. There are certain potential adverse effects associated with the drug, like heart rate getting too slow. It's a heart rate slowing drug. Or having abnormal heart rhythms that we wouldn't want to have. Or studies have shown that that women who are pregnant and have children may have children with birth defects while they're on Corlanor, so they shouldn't get it while they're pregnant. There are other adverse effects, but those are the ones that we're most concerned about.
Yes, doctor, all really important points. Now, where can people go and actually learn more information about Corlanor?
Well, of course, the first thing to do is to talk to your doctor. But beyond that, if you want to get additional information, there's a website. It's corlanor.com, where you can learn more about heart failure and more about this new drug, Corlanor.
Very good. Dr. Jeffrey Borer, thank you so much for being on with us today and telling us about this important info.
Thank you, Alex.
All right, and stay where you are. The Morning Blend will be right back.